So today we're going to be talking about radiation therapy and the uses for it, how it came about, the advantages, disadvantages, what we do as radiation therapists do. So everyone knows Wilhelm Röntgen. He was the inventor of X-ray, which was created in 1895. This is Marie Curie. She discovered a radioactive element that led to the discovery of radiation therapy. This is Tag Sundgren. I can't say his name, but he was the first one to effectively cure and treat cancer with radiation therapy in 1899. So, radiation therapy, it is used to kill cancer cells. It can be used in many different cases and many different types of cancer. It can also be used to help in the removal of a tumor. So if a tumor is too big to be surgically removed, they'll use it to shrink it down so it's actually accessible and they can remove it that way. It's also used to prevent cancer cells from spreading throughout the body and going to other areas. It's also used when a patient has an inoperable brain tumor or tumor in general, which means it can't be removed through surgery, no treatment will cure it. This type of tumor normally ends with a death sentence, but using radiation treatment, it will help the patient have a more comfortable state and it will relieve a lot of pain for them. In some cases, radiation therapy can also help other types of cancer. It can help early stage Hopkins disease, non-Hodgkin's lymphoma, and certain types of brain cancer and prostate cancer. So I'm going to show you a little video about going through the process of people that have gone through radiation therapy before we jump right into how it's used, what type of radiation therapy is used, and how people can react to it.
It's very easy. After the first one, it's the same thing every day. So you go in and it's the exact same treatment. The machine moves around you exactly the same as it did the day before.
Radiation is usually given daily, and appointments generally take 30 to 45 minutes, although only 15 to 30 minutes might be spent in the treatment room. Try to arrive 15 minutes early so you can get changed and be ready for treatment. To be safe, even if they just saw you yesterday, the radiation therapist will verify your identity by asking your name and date of birth. Treatment is much like verification. The therapist will carefully position you on the table. Although they leave the room during the procedure, they are nearby and able to see and hear you. You will be asked to breathe normally while the machine moves and buzzes as it administers radiation. You will not see or feel the radiation. At least once a week, the therapist will take X-rays. Since you are already in position, these only take a few minutes. As soon as treatment is complete, you are free to go. Throughout the process, the Cancer Center team performs a series of quality checks to help assure your safety. Your radiation oncologist reviews your X-rays to determine if any adjustments are necessary. The radiation oncology team discusses your treatment in a group meeting each week. Periodic peer reviews of patient treatment plans are also part of our continuous improvement process. Your radiation oncologist will meet with you once a week to discuss side effect management. Feel free to ask questions during this meeting or at any point throughout your treatment.
Anytime you have a question, they're always there to answer it. I think I went to the nurses station at least once a week because I needed to ask the nurses for something or ask a question or ask if I should be feeling this, if the therapist didn't know. The nurses, always knew, and if they didn't know exactly what you needed, they would, speak to the doctors that were there.
People react to radiation therapy in different ways. Some people lose their appetites and shed some hair, while others need daily naps. Listen to your body and be patient with yourself. Eating well and getting plenty of rest will help your body heal.
Listen to your body.
Okay, so after that video, you know pretty much the basic steps, how long the treatment can take, and how it's pretty painless. There's not that many side effects. Some people react different. So we're going to go a little bit more in depth now. So there are two different types of radiation treatment. You have external, internal, and the differences. But first I'm going to give you a little bit of an overview on how it works. So radiation therapy, like the video said, is painless. Radiation focuses on only one part of the body that's targeted, so the tumor, wherever it's located, the radiation goes directly towards, and it doesn't go throughout your body anywhere else. Unlike chemotherapy, which normally works hand in hand with radiation treatment, chemo goes all throughout your body. It goes through your veins. It goes through a port that's normally inserted in your chest, and the treatment will go throughout your body. So radiation treatment is localized to the tumor, and there's a beam of radiation that goes directly into the patient. Radiation therapy is designed to kill cancer cells using high doses of radiation. This causes damage to their DNA, which will intend to block the cancer cells from growing and increasing in number. One factor of cancer cells is that they divide and grow very rapidly. That being said, radiation treatment is given in small doses over 6 to 7 weeks for 5 days a week. An outpatient visit, which is normally done in a hospital. For external radiation therapy, a radiation oncologist will determine the amount of radiation that's needed to treat the type of cancer. The amount of radiation is not delivered at a one-time sit. Like I said, it's normally for 6 weeks, for 5 days a week, and it takes about 45 to an hour. So throughout that period of time, the dose is broken up into a fraction for the period of time. The radiation plan is based off of the individual factors, so what type of cancer, the size of the tumor, and how rapidly the tumor is growing. This way of treatment is delivered by having the patient laying down or in a seat with a protective shield over their body, covering other parts that the treatment is not intended to, just to protect them, because they are getting a high dose of radiation in case there is any type of scatter. So a technician will direct the beam towards the specific spot and where the cancer is located, and that's how that type of treatment is done. It's in and out. You sit there, like the video showed, you sit on a table or lay on a table, the beam is directed into the targeted area, and that's how it's delivered. Internal radiation is a bit different. That's when a small radioactive material is sealed in an implant. The implant is placed directly within the cancerous tissue or the tumor to deliver direct radiation. This implant may be permanent or can be removed. The amount of time that the implant is implanted for is based off the type of cancer, the size, and all the other variables that the external radiation treatment was specific to, so isn't the internal. It can stay in a patient for minutes up to months. And while this implant is implanted, the patient is radioactive, so the patient will be sending off small doses of radiation. So it's better to stay away from children, stay away from pregnant women, because you are radioactive. The way they insert this type of implant is through the scope of MRI. So they'll use MRI or X-rays to direct them and make sure they're guiding it and putting it in the right place. Normally this type of implant is done under localized or general anesthesia, depending on the patient. The implant can be sealed within a radioactive ribbon, a wire, a needle, balloon, or tubing. So they'll put the radioactive seed, in any type of these types of seals, and they'll implant it directly onto the tumor, into wherever it needs to be, and they'll leave it in there depending on how long and the type and all those other factors. A few differences between internal and external radiation is that the patient is becoming radioactive after receiving the internal radiation, and also during having an internal implant for internal radiation therapy, the patient will have to stay at the hospital during this time, most likely, because they are giving off small doses of radiation and they want to be able to keep an eye on them and make sure everything's going well. Advantages are sickness, vomiting, nausea, diarrhea, you can become anemic, hair loss is going to happen if you're having chemo normally, and then radiation can add to the hair loss. Skin burns, this is an example of a skin burn. You're receiving such high dose of radiation to a localized area. It could happen, it might not happen to everyone, but it could happen, and that's a little example of it. It's also an example of like the start of some hair loss for a cancer patient. And so, what do radiation therapists do? They do a lot, actually. And personally, I believe that the main thing that they do is they provide support for the patient. Radiation therapists are the ones that have direct contact and direct patient care. They are the ones that they're going to lend a hand when a patient's feeling down. They're going to be the shoulder to cry on when patients don't know if they can do it anymore. Cancer is a very emotionally draining thing. I know it personally. And my grandfather's radiation therapist, we were all close with. She was the nicest lady. She made sure that we knew he was okay when he wasn't with us and that when he was receiving treatment. So that's my biggest thing that I really appreciated, and I think that on the list of everything that they do, that's their number one quality, and it takes a special type of person to do that. Personally, I don't think I could do that. I am not that emotionally attached to people. These people they have to be. You have to be able to connect to your patient on an emotional level. So, what else do they do other than that? They get their patient in the correct position. This person has to have their hands up above their head to receive the direct radiation. This person is laying on their stomach. These two radiation therapists are getting them into the position. They're putting a belt over them, locking them in the position that they need to be. And the radiation therapists are the ones that actually administer the amount of radiation dose that the patient's given. The radiation oncologist is the one that set the dose amount, and they're the ones that actually administer it. Just like we take the actual exposure of an x-ray, but radiologists are the ones that read them. So finally, how do you become a radiation therapist? Well, just like everyone, you're gonna have to go to school. You can get your associate's degree, you can get your bachelor's degree. The bachelor's and associate's degree are going to be in like x-ray, and you can venture off into radiation therapy. When you're in school, you're going to do your physics, you're going to do anatomy, patient care, all that stuff. You're going to have to get comps, and not only in technical comps, you're going to have to get emotional comps. And they make sure that you can communicate effectively with your patient and their family, that you can have an emotional connection with them. And you're going to take your registry, just like we do. And the ARRT is the one that gives them their test. And what everyone wants to know, how much do they make? They make $80,550. And that pay is set to increase by 13% within the next 10 years. These people have the most compassion, like I said. They are so emotionally connected with their patients. It takes a special type of person to be a radiation therapist, but if you think you can do all that and be a good tech and be around high dose radiation, sometimes you are in that situation, like when you're implanting radioactive seeds, you're going to be near, you're going to be assisting most likely. So if you can do all that, we need more. It's a high demand job, and every day someone's diagnosed with cancer, every day someone needs treatment for at least 6 weeks, and the amount of people that get radiation treatment is astronomical. So that's all I have to say on radiation therapy. Thank you.